A very good morning, everyone. Today's most important topic is Trio of Restlessness. This question is very important because these questions you may get in Viva, university exams, and other competitive exams. And these questions frequently asked in Viva, and also this is the most important questions in university exam, especially in CBDC batch. So, not wasting time, let's start the topic. Okay, before starting, I want to declare that this note is completely authentic. You may get these notes from online and others resources, but trust me, this is the most authentic and precise note. This is the complete note for your university exams. So let's compare these drugs. So in exam hall, you should mention the Trio of Restlessness. What are the Trio of Restlessness? First is aconitum nepalus, arsenicum album, and ras toxicodendrons. So first mentions these three medicines, then compare. Okay. So among these three medicines, first point is restlessness in which sphere? First of all, in aconite, especially restlessness in mental and physical both sphere. In arsenicum album, especially restlessness in mental sphere. Mental restlessness is marked. And rastox is physical restlessness. Physical restlessness, the restlessness is in only physical plane. Second point, in aconite, the patient is strong and robust and moves frequently. In aconite, the patient is very strong, healthy. Robust means very healthy and strong and moves frequently. Not like arsenicum album, because in arsenicum album the patient is he is able to move only his limbs until at last he becomes so weak that he is not able to move and lies in perfect quietness due to extreme prostrations. In arsenicum album, what we see that here the patient is very debility, and patient has very debility and prostrations, so he can't move her limbs and others organ, even not moves here and there. So great durability marks features in arsenicum albums. And if you compare with rustox, here you can see that patient's continuously movement. Patient can't stay in one place and must change his position frequently to obtain the relief from pain. Especially in rustox in PJ, as it is physical restlessness is marked, so the patient continuously moves from one place to another. So these are the mental spheres and how the patient's constitutions. Then third point is that restlessness is yearly. In which stage the restlessness is seen? First of all, in aconite, the restlessness is yearly stage of the disease with high grade fever. As we know, aconite is the especially in very acute remedy and sudden violent onset. So restlessness is seen in early stage of the disease. In any disease, the restlessness is occurred especially in early stage and also with high grade fever. Arsenicum album, here we can see restlessness come in later stage, because in later stage what happened? In later stage the patient has great debility and prostrations, so the restlessness is occurred in the later stage of life when the patient's loss is full strength. The patient's loss full strength, then we can see the restlessness. And third point, in this point, the rastox, where we can see the restlessness with pain. So fourth point, here we can see in aconite there is a great fear, anxiety. How the patient's mind, actually patients with great anxiety and predict the time of death. And if we compare with arsenicum album mind, here we can see patients having suicidal tendency and does not want to call doctor because he feels his disease is incurable. In comparisons, aconite and arsenicum album, here we see both are different, because in aconite's mind, here that there is a great fear, anxiety and predict the time of death, and in aconite patients always want to call doctor. But in arsenicum album, where you can see having suicidal tendency and does not want to call doctor because he feels that his disease is incurable. he know that his disease is incurable, so he don't want to call doctors. And Rust talks, there is no specific for mind of the patients, so you can leave this. Then the last most important point is modality. In aconite, where you can see that the aggravations from rising from bed, lying on affected site, warmth room and evening. In the case of arsenicum album, where you can see aggravated from the lying on cold midnight, especially on 1 to 2 a.m. and also lying on affected site with head lower. In the case of Rustox, where we can see the aggravated from night, cold, damp weather, first motion aggravation, and also it's the most important keyword is first motion aggravations and continuous motions ameliorations. And in the case of aconite, where you can see that ameliorated by open air uncoverings. In the case of arsenicum album, where you can see the ameliorated by head cool. One of the key features or characteristic features of arsenicum album, the patient is aggravated from the cold, but the patient ameliorated on the only for head cold, and also ameliorated by heat. But the arsenicum album patients always want to keep his head always cool. So these are the characteristic features of Trio restlessness remedy. So I think this video is, so here the full comparison of the Trio of restlessness remedy. If you want to get the HD quality note, so you can follow on Instagram Bong Lucent. Here I can upload the full note with HD quality, so you can write easily. So thank you very much.